Sorry, you guys, I'm just trying to get this to play. For some reason the audio is not rolling. So this is this is the nursing chapter in this people's
care of body after death. As soon as the patient has stopped breathing and death is certain, straighten the limbs and place the arms by the side or across the chest as desired. Close the eyelids and keep them closed either with your fingers or by placing something upon them. If false teeth have been worn, they should be placed in the mouth soon after death before the jaws have set. Then close the mouth and tie a handkerchief under the jaw after first putting a pad under the jaw. Tie the handkerchief on top of the head, tight enough to make the mouth closed and look natural. Comb and, if a woman, braid the hair. Also wash and dress the body if so desired and at the same time change the bed linen. Tie knees and ankles together with a broad bandage. You can also bind the hands in place if necessary. Make the body look natural and comfortable and cover with a sheath. If the body is clean, I never could see the use of washing it after death. It seems a needless exposure and an unnecessary annoyance to the relative. Call an undertaker, but do not let him use an injection until death is an absolute certainty. If you are not certain of death, keep the body until signs of decay are seen before you allow any injection or preparation to be used. Not many people have been buried alive, but some have been, so keep your friends till death is certain. Displacement of the body or extremities sometimes occurs after burial. This is generally due to a sudden contraction of the muscles. It does not often occur, but such cases are on record. The person was dead but simply had an after-death contraction. I always advise the undertaker to delay as long as possible before preparing the body, and in cold weather I can see no necessity for using any preparation on the body. Accidents and emergencies. What to do and what not to do. Apoplexy. See general treatment. Place patient in lying position with head higher than bod. Loosen clothing and apply cold water to head. Put feet in hot mustard water. If tongue draws back, put towel or handkerchief over it and keep it forward. Keep bowels open and draw urine if necessary. Patient must remain quiet. Asphyxia or suffocation. Use artificial respiration as for drowning. See drowning. Bandaging. See chapter following. Bites of snakes. If on a limb, tie a rope or handkerchief around a limb just above the wound. Cleanse the wound at once. Suck the wound. If the poison is swallowed accidentally, it is not very dangerous. Cut the wound open so the blood will flow freely, then fill it with salt, or, if you have it, use permanganate of potash. Give full doses of this drug hypodermically about the wound. It should be diluted 3/4 with water and should be followed with full doses of brandy or whiskey. Tie tight above wound with ligature and open wound thoroughly. People's Home Remedies 1. Plantain leaves. Suck out the poison and after cutting the wound, open, apply bruised plantain leaves and give a teaspoonful of the juice from the bruised leaves every hour. 2 baking soda. Cut open the V/ound. Suck out the poison and apply moistened baking soda. Keep the parts wet for several hours. 3 lime. Mix 2 tablespoonfuls of chloride of lime with 1/2 pint of water. Purify the wound promptly and freely. 4 turpentine. Turn a bottle of turpentine upside down over the snake bite and hold it there until relief is obtained. 5 chicken entrails. Kill a chicken and while warm cut open and lay upon wound, entrails, and all, and it will draw out the poison. Physicians remark. This draws well. It had better be applied after the wound has been sucked and cauterized. 6 tobacco and salt. Moisten some tobacco and salt and tie on wound as a poultice. 7 onions and salt. Apply a poultice of onions and salt. 8 salt and lamp oil. Apply table salt and lamp oil. Note. Use the above after sucking and cauterizing. 9 sucking. Suck the wound. Bites of rattlesnakes. Cleanse and suck the wound and use permanganate of potash as directed under snake bites above. Cauterize by applying a red-hot iron. People's Home Remedies 1. Salt. Apply salt at once. 2 soda and salt. Bandage above the wound, rub the swelling downward, poultice with soda and alternately keep the wound in fresh soda and salt water, changing frequently. This receipt is from a person who has had experience. Bites and stings of insects. For stings of hornets or bees, pull out the sting and apply peroxide of hydrogen. Vinegar either pure or diluted is good. Apply a mud poultice made of clay. For mosquito bites, apply phenol, 1 part, mixed with water from 50 to 100 parts. People's Home Remedies 1. Witch hazel. Freely applied, this gives quick relief in cases of bites or stings of mosquitoes, spiders, snakes, bees, or wasps. 2 ammonia or salt. For bites and stings of insects, bathe the pans frequently with either ammonia water or salt and water. Physician's note. Ammonia destroys the local poison by blistering the part, thus drawing out the fluid poison. 3 olive oil. Apply olive oil to the parts. 4 clay. Wet clay, earth or black mud applied to bites and stings is one of the best remedies and one that is easily obtained. Physician's remark. I know this to be good. There is sometimes danger of infection, but often other remedies are not at hand. 5 arnica. Tincture of arnica is an old and tried remedy. 6 plantain leaves. In case of a bad bite or sting of an insect or a snake, apply a poultice made of common plantain leaves. This is one of the very best remedies, and one does not generally have to look far to find plantain, as all are aware who have tried to keep it out of the lawns and gardens. Physician's remarks. Plantain has quite an action on the skin. It is also good for IV poisoning, burns, scalds and bruises. Pound the fresh leaves to a paste and apply. 7 catnip and plantain. Another lady writes that for bites and stings of all kinds of insects, she applies bruised catnip and plantain leaves to the parts and gives a teaspoonful of the juice of the plantain every hour. 8 salt and soda. Table salt and baking soda, in equal parts, applied to spider bites will relieve the pain and stop the swelling. Physician's remark. Salt draws and soda soothes. 9 onion. For bites and stings, apply a piece of raw onion to the wound. Change the piece of onion every 10 minutes and relief will soon be obtained. One physician says he uses no other remedy. Physician's remark. Raw onion is irritating and stimulating to the skin and causes the skin to discharge a fluid, thus ridding the part of the local poison. Keep on for 3 or 4 hours. 10 baking soda. Apply baking soda to the affected parts for stings. 11 clay. For stings, apply a poultice of clay. 12 coal oil. In case of stings, apply coal oil freely. Bites of dogs. See article on hydrophobia in General Department. Bites from cats, see hydrophobia. People's Home Remedies 1. For bites from cats, bathe the parts bitten with extract of witch hazel, or if badly bitten, wet cotton cloth in the same and bind on and keep parts wet. I have found witch hazel will kill all such poison. Physician's remark. Better kill the cat. Bleeding or hemorrhage. For bleeding from nose, see nosebleed. Apply alum locally. Eat cinnamon for uterine hemorrhage of the oozing kind, or use tannic acid diluted or white oak bark tea locally as a douche. Common salt is good for light bleeding. If the bleeding is from an artery and comes in spurts, tie a rope or handkerchief around a limb between the wound and heart. Put a stick under the rope or handkerchief and twist tight. If the bleeding is from veins, put the rope or handkerchief on the side of the wound farthest from the heart. If a finger is cut, tie a cord about it tightly above the wound and press on the artery with the fingers. In severe bleeding, place the patient flat on the ground and have him smell of camphor or ammonia. If the hemorrhage is from the lungs, the blood will be a bright red and be mixed with air and consequently frothy. If the blood is from the stomach, it is more likely to be of a dark color. In either case, have the patient lie flat and remain quiet. Give strong salt water and give the patient ice in the mouth. If the bleeding is from the stomach, apply cloths wrung out of cold water to the stomach. People's Home Remedies 1. Vinegar. For bleeding from the stomach, give 2 teaspoonfuls of vinegar or a little cold water every half hour. Physician's remark. Vinegar is slightly astringent. 2 lemon juice. To stop bleeding from the stomach, an excellent remedy is 2 teaspoonfuls of lemon juice in some cold water. Repeat this every half hour until the bleeding stops. 3 ice. Give the patient a little cracked ice until the bleeding from the stomach is controlled. 4 sage and honey. To stop vomiting of blood, give 3 teaspoonfuls of sage juice mixed with a little honey. Repeat in 15 minutes. I pound necessary. 5. Salt *. Small quantities of salt will stop bleeding from the stomach or lungs. A teaspoonful or 2 is generally sufficient. 6. Alum. Pulverized alum dissolved in water is good for bleeding from the stomach. 7. Cranesbill. Powdered cranesbill applied to the parts and covered with a compress of cotton is good for bleeding and for ulcers. 8. Flour and salt. A mixture of flour and salt in equal parts bound upon the cut will stop bleeding. Physician's remarks. Salt is an astringent and therefore contracts the blood vessels, thus keeping the part from being congested or overcrowded with blood. In this way it stops bleeding and also helps to cure inflamed eyes. 9. Black tea. Finely powdered black tea bound upon the cut is one of the very best remedies used by many surgeons. Where a doctor is not at hand, many lives would be saved if this remedy were more generally known. Physician's remark. Tea is an astringent and also has a soothing effect. 10. Rosin. Bind some finely powdered rosin upon the cut. This is a very effective remedy. 11. Charcoal. Take some charcoal made by burning rags, put it in the wound and the bleeding will stop. If a person be away from home with no aid at hand and the cut is severe, he should not hesitate to burn a handkerchief or even a part of his clothing. This treatment should be more generally known especially by those who are alone in the woods using axes. 12. Alum water. If the bleeding is from the cavity of an extracted tooth, pack the part with cotton wet in alum water. Physician's remarks. Alum is an astringent and contracts the blood vessels so that less blood goes to that part. 13. Cobwebs or puff balls. Either cobwebs or puff balls will stop bleeding and should be used if nothing else is at hand, though care should be taken that they be not mixed with filth of any kind or poisoning might be the result. 14. Wood ashes. Wood ashes bound upon the cut will stop bleeding. It is also effective for a horse that has been cut in a barbed wire fence. 15. Brown sugar. If the cut is slight, bind some brown sugar upon the parts or apply wet brown paper. 16. Sole leather. Shave the flesh side of sole leather and bind upon the cut. 17. Gunpowder. Put some gunpowder on a piece of cotton batting and bind upon the cut. 18. Copperas and alum. Styptic powder is composed of 1 ounce of copperas and 1 ounce of alum. Each article should be pulverized and mixed. Put on a shovel, burn to a red heat and then dry to a red mixture. Pulverize finely and bottle for use. Sprinkle on the wound in the dry form. There is nothing better. 19. Lamp oil. Pour some lamp oil upon the wound. Bones, broken, and fractured. See chapter on bandaging which follow. S.J. Blisters and blood blisters. People's Home Remedies 1. Warm water. Bathe the blistered parts frequently in warm water. This is muchly better than drawing a thread through them as many do. 2. Tallow. Make a salve by dropping the tallow from a lighted candle into a little gin. Apply this at night before going to bed if the blisters are on the hands or feet. 3. Drilling nail. If the finger is bruised causing blood blister under the nail, it should at once be drilled with some sharp pointed instrument so as to let the blood escape. This will give immediate relief, while otherwise it might become quite painful. 4. Sweet oil, beeswax, and turpentine. To prevent the forming of a blister, apply immediately the following salve to the bruised parts. Take equal parts of sweet oil, beeswax, and turpentine, Melt the wax and oil together, and when pretty cool add the turpentine and stir until cold. Spread on a cloth and apply. This is excellent for bruises or scalds. 5. Poultice of cabbage leaves. An old remedy in use among the Romans for blisters was a poultice of cabbage leaves. Put them into warm water to soften and apply while warm. This remedy is still used by many nurses in our large hospitals. Physicians remark, cabbage leaves have a soothing effect somewhat like lettuce. Bruises and slight cuts. Apply arnica freely. Lead water diluted with 4 parts of water may be applied locally if the skin is not broken. Another good application is laudanum, 1 part, lead water, 4 parts, and water, 16 parts. For severe bruises I always give arnica internally, in 5-drop doses every 3 hours. People's Home Remedies 1. Witch hazel. Bathe the parts freely with witch hazel. 2. Arnica. Take 1 part tincture of arnica and 6 parts water. Wet a cloth with the liquid and apply over the bruise. 3. Mullein leaves. Fomentations of mullein leaves are excellent for bruises and swellings on either man or beast. Fomentations are explained at beginning of herb department. 4. Cranesbill. An excellent thing for cuts or wounds where the skin is rubbed off is cranesbill leaves bruised and applied to the parts. 5. Rosin. You will find nothing better for a cut than powdered rosin. Put a little on the injured part, wrap with a soft cloth and keep it wet with water. 6. Alum B/Ater. Cuts or bruises will quickly heal if bound up with a cloth wet with alum water, writes a lady from Minnesota. 7. Salt pork. If you have stepped on a nail, bind a piece of the rind of salt pork on the part and keep quiet till it heals. Physicians remark, first put on a hot bread and milk poultice, change frequently and keep on until the wound bleeds well, then put on the salt pork. Hot water. A treatment used extensively in hospitals is to dip pieces of cotton batting into very hot water and apply to cuts, bruises, and sprains. 9. Cold water. Bathe the bruised parts thoroughly with cold water. 10. Chloroform Lineament for bruises. Mix 1 ounce of chloroform, 1 ounce of ammonia, 1 ounce of laudanum and 1 ounce of sweet oil. Bathe the parts well to be shaken well before using. A lady in Bethany, W.Va. says she has used this chloroform lineament for years and always with good results. 11. Smoking. Take live coals, burn woolen cloths upon them with a small pinch of sugar, hold bruised parts over the smoke. Will take all soreness away. A lady living at Garrettsville, Ohio, says she has used this many times with excellent results. 12. Sugar and camphor. Brown sugar and spirits of camphor tied on, or a poultice of comfrey roots, will remove the blueness of a bruise. 13. Smartweed poultice. Steep some smartweed, thicken with wheat flour and make into a poultice. A lady living at Independence, Iowa, says her husband was very badly bruised in a runaway and that the application of this smartweed tea made a new man of him. 14. Hot water. Another lady who speaks from experience says that hot water is the best thing that can be used to heal a sprain or bruise. The wounded part should be placed in water as hot as can be borne for 15 minutes and in all probability the pain will disappear. Hot water applied by means of cloths is a sovereign remedy for neuralgia or pleurisy pains, burns and scalds. Lime water with equal parts of either linseed oil or olive oil is very good. For small burns, washing soda is good. The application of either cold cream, Vaseline, or pinoline is also very good. If the skin is not broken, very much dust on some boric acid powder and then apply either Vaseline or pinoline. Pinoline is preferable. To make beeswax ointment, take 6 ounces of benzoate lard, 1 ounce of yellow beeswax and 20 grains of salicylic acid. Melt the wax in a tin cup, then add the lard. When all is melted, remove from the fire and stir till cold. Then add the salicylic acid and continue stirring until cold. It makes a varnish over the burned parts that excludes the air and sheds moisture. People's Home Remedies 1. Wood soot and lard. Apply wood soot ointment, which is made by mixing an ounce of finely powdered wood soot with 4 ounces of lard. It should be spread on cotton batting and applied to burns, scald head or other diseases of the skin. Physicians remark. This acts as a local sedative and quiets pain. 2 lime water and linseed oil. Apply equal parts of lime water and linseed oil to the burns or scalded parts and cover with raw cotton. If desired, 1 part of carbolic acid may be added to 50 parts of the liquid. Lime water alone is good. Physicians remark. This forms a covering, thus keeping the air from the burn. 3 Castile soap. A nice application for burns or scalds is Castile soap scraped and mixed with water till it makes a thick lather. Spread this thickly on a piece of linen or cotton cloth and apply to the burned surface. 4 Flour. Flour sprinkled on the burn or raw cotton spread out thin are good applications. 5 Baking soda. A fine thing for burns and scalds is 2 tablespoonfuls of baking soda dissolved in a pint of water. Wet cotton cloths in this solution and apply to the parts. Keep wet and well wrapped up. 6 Alum water. Dissolve 2 ounces of alum in a pint of water. Saturate cotton cloths in this alum water and apply to the burn. Keep well wrapped up and the pain will soon be relieved and healing commenced. Cosmoline. Dress the burned or scalded parts with cosmoline and cover with 1 thickness of cotton cloth, then, to keep out the air, wrap the whole with absorbent cotton. A number of persons write telling of the excellent results obtained from the use of this remedy. 8 White of egg. Perhaps the most soothing application for burns or scalds is the white of an egg. It thoroughly excludes the air and stops the smarting pain and is always at hand for immediate use. Physicians remark. This will be found to be an excellent application for burns and scalds. 9 Alum, lard, and eggs. Add a dram of finely powdered alum to a teacupful of lard or Vaseline and mix thoroughly with the whites of 2 eggs. Spread on a cloth and apply. This is especially valuable where the skin has been burned from a large surface. It prevents inflammation and gives almost instant relief. 10 Charcoal. Finely powdered charcoal is excellent when applied to burns. 11 Scraped potato. A poultice of scraped raw potatoes is a fine application for burns or scalds. Powdered charcoal may be mixed with the potato with excellent results. 12 Glycerin or sweet oil. Apply either glycerin or sweet oil. 13 Alcohol. For burns from carbolic acid, apply alcohol. If applied immediately, the acid will not even make the flesh red. 14 Clove oil and camphor gum. Take some olive oil and put in all the camphor gum it will cut. Pour a generous quantity upon the affected parts and bind up in clean linen. Apply fresh every day. 15 White of eggs and lard. Beat the white of eggs to a froth and then beat in some fresh lard. Apply and bind up with clean linen. Physicians remark. This forms a coating and keeps the air out. 16 Vaseline and carbolic acid. Apply Vaseline plentifully, cover with absorbent cotton and then wrap with a cloth. For serious burns, bathe twice a day by dipping a clean cloth into warm water with a little carbolic acid in it, but do not let the cloth touch the burn. Only let the water drip on the wound and then apply the Vaseline fresh, immediately after the bathing each time, until well. It is a sure cure. 17 Gum arabic and carbolic acid. Take 1% ounces of gum arabic, 4 or 5 drops of carbolic acid and 1 pint of rain water. Boil the water and put the gum arabic into it to dissolve, and when cold add the carbolic acid. Apply to burns and scalds. Physicians remark. This forms a good coating. The intent in treating burns and scalds is to apply something soft to the part to exclude the air. Oily, greasy substances are generally good and are generally at hand. Cream, Vaseline, and lard are good. 18 Boracic acid. Apply powdered boracic acid dry to the parts. Keep the parts dry with it all the time. Just for a small place on the hands, apply the white of an egg. It will not blister and keeps the air away. A lady writes that her little girl fell on a stove and burned her face and hands terribly. She applied the boracic acid as above and not even a scar was left. 19. Lard. Spread lard on a clean cloth and bind on the affected parts. The lard must not be salted. This is a simple and good remedy. The lard should be spread on quite thick. 20. Flour and sweet oil. Cover immediately with flour and then put on sweet oil and bandage quickly. Physicians remark. This is a good sensible remedy and is practical, for you nearly always have it at hand. Choking. For choking from a foreign body, such as food, slap hard on the person's back between the shoulders. If it be a small child and cannot otherwise be relieved, take hold of the heels and turn it upside down and shake a little. Put your finger in throat, tickle and cause vomiting. Or, you can take the rubber tube from a syringe after the hard rubber part has been taken off and put this tube down the throat. This will cause vomiting or will push the object down the gullet and allow the person to breathe. Of course, if the object is in the windpipe, you must not push it down. People's Home Remedies 1. How to treat for choking. Seize the patient by the heels, hold him head downwards and strike sudden blows between the shoulders. This treatment has saved many a child's life, and every mother and nurse should remember it in case of emergency where a doctor is not at hand. 2. Raw egg. Break an egg into a cup and let the patient swallow it at a gulp. 3. Blowing into ear. A naval surgeon writes that any foreign body which is lodged in the throat can be removed by blowing forcibly into the ear. 4. Pressing on tongue. Put the finger far back in the mouth and press upon the back part of the tongue to cause vomiting. 5. Potato or bread. Have the patient swallow a large piece of potato or bread. 6. Mustard water. Give an emetic such as mustard water. Convulsions or spasms. Keep the child perfectly quiet and put ice or cold water cloths on the head. Put feet in hot mustard water and wrap entire body in towel which have been dipped in warm mustard water. Use 2 heaping tablespoonfuls of mustard to a quart of warm water. If there is undigested food in the child's stomach, produce vomiting by tickling the throat. Put the handle of a knife or fork in the child's mouth to prevent its biting your finger or its own tongue. If there is anything irrth, hot bath must be resorted to. Have the water at about 106 degrees or put your arm in the water to the elbow. The water should then feel warm but not uncomfortable. It is well to add half a cup of mustard to the bath. Excepting the head, put the child's entire body in the water. To prevent the return of the convulsions, give the following internally: 1/2 dram of bromide of potash, 15 grains of chloral hydrate and 2 ounces of simple syrup. Mix and shake thoroughly and give a teaspoon lull every hour while the child is nervous or feverish. This dose is for a child a year old. People's Home Remedies 1. Warm mustard water. If the convulsions are caused by overloading the stomach, vomiting should be induced by giving warm water or tickling the throat. If the convulsions are slight, perhaps all that will be found necessary is to put the feet in warm mustard water. In case of severe convulsions, the following general treatment has saved hundreds of lives. First, put the child in a warm bath as soon as possible, and while in the bath, pour a steady stream of cold water upon its head but not from a great height. Continue to pour while the head is hot or until the fit has passed. Keep the child in a warm bath until the convulsions are over, which is generally from 10 to 20 minutes. When taken from the bath, wrap the child immediately in a warm woolen blanket without even stopping to wipe him off. Times it will be found necessary to inject the bowels with warm water, to which has been added a tablespoonful of sweet oil and a little of the suds from Castile Soap. Repeat this till the bowels move. This treatment is probably the very one your doctor would use were he called S&D in an emergency. Can be used equally well by the parent. Therefore, let this treatment be adopted by every mother who values the life of her child. Ph/Sicians remark. This treatment is used by many physicians and can be depended upon. It draws the blood from the head to the extremities and establishes a good general circulation. 2. Salt and water. Give a teaspoonful of salt and water and put the feet and legs in hot water. Physicians remark. The salt is to cause vomiting. 3. Mustard v/Ader. As soon as the fit comes on, dip some cloths into hot mustard water and wrap the child's feet and the lower part of the limbs, leaving the cloths on until the skin is quite red. 4. Hot water and salt. The simplest way to bring a child out of a spasm is to put its feet into hot water and force a little salt water into its mouth. 5. General treatment. Ice water to head and throat, hot water to feet and wrists, and as soon as possible put a mustard plaster or poultice to the wrists and soles of the feet. Give an injection of warm soap suds and also a mild laxative. Physicians remark. When the head is too hot, cold water will contract the blood vessels and cause less blood to be carried there. Hot water to feet and wrists causes the blood to flow better in the extremities. Mustard aids by increasing the circulation of the skin. When the head and face are red and congested, the aim is to get the blood away from the head and increase the circulation in other parts of the body. 6. Plot bath. As quickly as possible put the patient into as hot a bath as he can stand. 7. Salt and mustard water. Carrot teaspoonful of salt put into bath of warm mustard water. Cuts. C. Bruises and slight cuts. For severe cuts, see bleeding. Cramps. Externally apply belladonna liniment. Ginger tea is very good for menstrual cramp. People's home remedies. 1. Bandaging. If the cramp occurs in the leg, it can frequently be relieved by tying a cord around a leg above the cramp. 2. Drawing up foot. To obtain head from cramps in the calf of the leg, draw the top of the foot up as closely as possible to the shin and hold it there until the cramping has ceased. 3. Red pepper and whiskey. Apply red pepper and whiskey for cramps in the neck or leg. 4. Tansy, hops or mustard. Warm fomentations of tansy, hops, or mustard will relieve cramps in the stomach. 5. Various remedies. For cramps in the limbs, wear eelskin garters. For cramp.ps in stomach, make a tea of mirwan root and drink the same, or take 30 drops of Jamaica ginger diluted with water. 6. Rhubarb, cayenne, etc. Take tincture of rhubarb, tincture of cayenne pepper, tincture of opium, spirits of camphor and essence of peppermint, of each equal parts. For an adult, give a teaspoonful at a dose every half hour until 4 doses have been taken. 7. Hot applications. Apply hot applications. 8. Mustard poultices. Apply hot cloths. A mustard poultice is very good in some cases. Dislocations. See chapter on bandaging following. Dizziness or vertigo. This is often due to stomach, liver or bowel troubles and rarely to brain disease. Heart troubles, general weakness, and poorly fitting glasses are other causes. Vertigo frequently comes from biliousness and constipation and is sometimes due to fermenting food in the stomach and bowels. It is always a good plan to keep the bowels moving regularly 1 or twice a day. Eat less and do not eat food that disagrees with you. Rich, greasy food is not good for persons suffering with vertigo. See fainting, drowning. Remove all dirt, saliva, etc., from the mouth and, pulling the tongue well forward, hold it there with forceps or by means of a cloth passed around it and held by the hand. Remove clothing, especially from the upper part of the body. Place tfie patient on his stomach, stand straddle of him and lift him up by putting your arms around the middle of his body and let his head hang down so the water can run from the lungs out of the mouth. Turn the patient on his back and place a roll of clothing under the small of his back. Also place something under his shoulders and head. Use artificial respiration. Stand or kneel above or at the head of the patient, grasp the arms at the elbow and draw them steadily and slowly upward above the head and keep them stretched for a couple of seconds. Then bring the arms down to the sides again and press them firmly for a couple of seconds against the sides of the chest. Repeat these movements regularly from 15 to 20 times a minute and persevere in them for an hour or even 2 hours if necessary. An assistant should press on the lower border of the ribs and pit of stomach while the arms are pressed against the sides. Rub the limbs IV while this is being done. Dash hot and cold water alternately upon the chest. If necessary, put in warm bath while artificial respiration is still continued. The clothes must be taken off, the tongue-G-UE drawn out and the mouth cleaned quickly and artificial respiration commenced as soon as possible. After breathing has been established, put the patient into a warm bed in a room which is kept well ventilated. For nourishment and as a stimulant, inject the bowels with brandy and beef tea. Do not let bystanders crowd about the patient and keep the air from him. Ear, things in. Insects sometimes get into the ear. Pour water as hot as it can be borne into the ear and hold it there for a few minutes. Then turn the head and let the water run into a basin so that you can see whether or not the insect comes out. If foreign bodies are in the ear, you can use an ear spoon, but it must be used gently. A crochet hook or a email hairpin properly bent may also be used. Do not use force, for the ear is very easily injured. If you cannot get the body out easily, you should see a doctor. Epilepsy, see fits. Things in. If under the lower lid, pull the lid down and wipe the object off with a smooth cloth. If under the upper lid, put the first finger of your left hand in the center of the lid about half an inch from the edge and take hold of the eye winkers with 2 fingers of the other hand. Pull down and then up over the finger of the left hand, thus exposing the inner surface of the lid so that the object may be wiped off. The patient should look at the end of his nose while this is being done. A flax seed placed in the eye will frequently push the object from under the lid. Another way is to pull the lid down with the fingers and then blow the nose violently. If some foreign object like a piece of steel is lodged in the ball of the eye, a doctor will be required to remove it. People's home remedies 1. Removing with pencil. Roll the lid upward over a lead pencil, then draw the pencil backward and forward several times. This seldom fails to remove the foreign body. 2. Blowing nose. With the thumb and finger, keep the eye open while blowing the nose vigorously. 3. Flax seed. 1 grain of flax seed put in the eye. 4. Treatment 4. Shut the eye and take hold of the upper lid by the lashes, roll the eye around and pull the upper lid down over the lower one and let go. 5. Immersing in water. To remove dirt from the eye, immerse it in cold water and while thus immersed, roll and wink the eye till the dirt is worked out. 6. Olive oil. A celebrated eye specialist of Holland says there is nothing better to remove specks, dirt or lime from the eyes than to pour olive oil into them till all hurtful substances are washed out. This, he says, is painless and seldom fails. 7. Camel's hair. Cinders and dust may be removed by wetting a small camel's hair brush in water, then raising the lid and passing the brush over the eyeball. Fainting. Do not get rattled. Place the patient flat on the back, loosen clothing, give plenty of air, sprinkle water on the face, put camphor, ammonia or smelling salts to the nose, rub the hands and feet and give brandy or whiskey. Generally the head should be placed low. Do not allow a crowd to gather and shut off the air from the patient. The head and face may be bathed with camphor or cool water. Have the patient remain lying down until the faint feeling is entirely gone. If the fainting is caused by some disease, stimulants should be given. People's home remedies 1. Aromatic spirits of ammonia. Give half a teaspoonful of aromatic spirits of ammonia in a wine glassful of water and you will revive the patient. 2. General treatment. Lay the patient upon his back and admit plenty of fresh air. The face should be sprinkled with cold water and the arms and legs should be rubbed. Hold spirits of ammonia, camphor or vinegar to the nostrils. As soon as the patient can swallow, give a teaspoonful of compound spirits of lavender. Falls. Immediately after a bad fall, do not allow the patient to lie down and sleep, as there is danger of the blood clotting in the brain and causing death. Keep the patient awake. People's home remedies 1. Salt water. To revive a person who seems stupid from a fall, give him salt water to drink. Use a teaspoonful of salt to a pint of water. Fire. C. Burns and scalds. If carrot or clothing is on fire, do not run, as this will but fan the fire. Throw a garment such as a shawl, rug, overcoat, or piece of carpet around the body and then lie down and roll. This smothers out the flames. Always keep your mouth closed or you will be burned internally. Put soda and sweet oil, linseed oil, or some kind of grease on the wounds until care can be given. Fits, falling fits, or epilepsy. For symptoms, see general diseases. Bromide of potassium is the remedy to be used and should be continued for months and years and should be kept up for 3 years after the patient is seemingly cured. This should be administered under the supervision of a doctor. People's Home Remedies 1. Oxide of zinc. A physician who has been very successful in curing epilepsy uses oxide of zinc. It should be taken 3 times a day. The first 8 days the dose is grain. Then take 1 grain doses for the next 8 clays. Then use IVI grains till cured. The dose seldom has to be increased over IFO grains. It is well while under this treatment to rub the spine twice a day with stramonium ointment. Fractures. See chapter on bandaging which follows. Freezing. Frost bites. People's Home Remedies 1. Rubbing with snow, witch hazel, etc. If one has been frozen, keep him away from the fire and thaw out the parts slowly. First rub them with snow, then flannel, and lastly with the hands, then bathe the parts frequently with witch hazel. 2. Alum water. Immerse the frozen parts for 10 or 15 minutes in alum water. Use from 1/4 to 1/2 pound of alum to a gallon of water. See chilblains, under skin diseases. Heart troubles. Palpitation. If a person has palpitation after too hearty eating and the stomach stems full, it is difficult to breathe, heart goes too hard and fast and the patient feels almost suffocated but has no valvular heart disease, give a teaspoonful of soda in hot water or peppermint water or hot whiskey or brandy. These will relieve the person by causing the gas to come up. The last 2 can be used in heart trouble. Fast heart. If anyone afflicted with heart trouble has palpitation, the heart beats fast, full and hard and throbs terribly, causing hard and labored breathing on account of the lungs being pumped so full of blood. Do not smell camphor, ammonia or nitrite of amyl because they would make the heart beat faster still. Such patients are usually sitting or lying propped up in bed. Give tincture of digitalis, 5 drops in a little water in a spoon. Put this carefully and slowly into the mouth. Give another dose in 10 minutes. And another in half an hour, if necessary, then every 3 to 4 hours for 12 hours. Weak heart. If there is a slow heart from overdoing or in asthma, grip, etc., have the patient inhale nitrite of amyl, camphor or ammonia and give whiskey or brandy, and then if you have them give digitalis or strychnia. In this condition the patient is unable to sit up, perhaps lies partly unconscious, is faint, weak, and collapsed, perhaps has a cold sweat and the pulse, which may be fast or slow, is weak, and hardly perceptible. If you have nitrite of amyl capsules, break 1 containing 3 to 5 minims on a cloth, and have the patient inhale it for a few minutes. Or have him inhale camphor or ammonia. At the same time give whiskey or brandy and watch the effects. Do not overstimulate. The best, surest, and most lasting in its effects is the digitalis or strychnia. If the strychnia is used, give 1 dose. 1/60th of a grain, and in half an hour give another dose, but never more than 2 doses. This can be given at the same time with the whiskey, brandy, or digitalis. Digitalis, with or without 1 dose of strychnia, in such a condition and from the causes mentioned, gives the best and most permanent relief. Give 5 drops at a dose. If nothing else has been given, repeat the dose in 10 minutes. If something else like the above or strychnia has been given, do not repeat the dose in less than an hour and stop the others. Repeat again, if necessary, in an hour or 2. See diseases of the heart in regular department. Heat stroke or sunstroke. For symptoms, etc., See regular department. The treatment must be bold and vigorous. If the temperature is too high, it may be reduced by applying ice or cold water. Strip the patient. Lay him on a canvas cot if one is handy, and then direct a stream of cold water upon his body. Rub actively and vigorously at the same time. This brings the blood to the surface and relieves the internal organs and the head. Rub thoroughly and at the same time constantly apply ice or cold water to the head. In other cases, the patient may be put in a tub and the above directions followed. WHETT the temperature falls, see that it does not fall too rapidly. Bleed the patient if he is robust and there is evidence of venous engorgement or blood in the veins. Then follow with normal salt injection. If constipated, give citrate of magnesia in 4-gram doses. If the patient is unconscious, give a hypodermic of 1/6 grain of elaterium for the bowels. Give strychnine if necessary to stimulate. Give no alcohol and have patient remain in bed several days. People's home remedies 1. Essence of ginger. Put the patient in a sitting position and pour cold water freely upon the head. Into half a tumbler of water pour 2 or 3 teaspoonfuls of essence of ginger and have the patient drink it quickly. Hemorrhage, see bleeding. Hiccup. This is caused by a spasmodic contraction of the diaphragm by which the air is suddenly drawn in. Give a 1-gram dose of tincture of musk or give 10 drops of chloroform internally. Another remedy is composed of spirits of camphor, 1 teaspoonful, tincture of capsicum, 2 to 3 drops, oil of amber, 5 to 10 drops, tincture of valerian, 1 teaspoonful. The whole is to be taken at a dose and repeated if necessary. People's home remedies 1. Nitre. Drink from 3 to 5 grains of nitre dissolved in half a tumbler of water. 2. Chewing. Press the fingers tightly into the ears and chew as though you were eating food. This is an old and tried remedy. 3. Vinegar and sugar. Drink several swallows of well-sweetened vinegar or eat a lump of sugar that has been thoroughly saturated with vinegar. 4. Lemon juice and sugar. Drink freely of lemon juice mixed with sugar. 5. Mustard, ginger, or soda. Drink frequently of hot water containing mustard, ginger, or soda. 6. Drinking through towel. Put a clean towel over a glass of water and drink water through the towel. This takes the mind from the hiccuping. 7. Drinking water. Drink 9 or 10 small swallows of water without breathing. 8. Placing fingers together. Without leaning on anything, see how nearly together you can keep the ends of the small fingers, being very careful never to allow them to touch. This concentrates the mind and seldom fails to effect a cure. 9. Swallowing. Take a drink of cold water or eat a piece of dry bread or something to cause swallowing. 10. Baking soda. Give a half teaspoonful of common baking soda dissolved in a little water. 11. Startling. Scare or surprise a person with hiccups. Speaking suddenly to them often startles them and cures the hiccups. Do not adopt this method with a person who has heart trouble. Physicians remark. A number of the above remedies perhaps have no real medical value, but they concentrate the mind of the patient upon something besides the hiccup and thus effect a cure. Hydrophobia. See this subject under infectious diseases. Nose, bleeding from. Epistaxis. Usually, bleeding from the nose will stop itself. Hold the arms above the head. Apply ice or cold water to the nose and to the back of the neck. Inject either hot or cold water into the nostrils. Either alum or tannic acid is good when dissolved in water or snuffed up the nostrils or applied with a cloth. Hold the nostril shut with the finger and apply something cold to the head and neck. Snuff salt water. If the bleeding continues, the doctor will ping the opening between the nose and the throat or will plug the nostrils with cotton saturated with a solution of adrenaline, 1 part to 2,000 of water, or with a strong solution of crane's bill. People's home remedies 1. Pressing on lip. Press hard on the upper lip near the nose or press hard on the under part of jaw near the angle of the jawbone. Physicians remark. There is a large artery in the upper lip near the nose and another runs up over the jawbone near the angle. Pressure on these parts checks the bleeding from the nose by shutting off the supply of blood. 2. Pressing on nose. Nosebleed can sometimes be stopped by pressure on the upper part of the nose as this closes some of the blood vessels. 3. Dried beef. Insert grated dried beef up the nostrils. Physicians remark. This not only acts as a plug but the salt in the dried beef aids in contracting the blood vessels. 4. Cold packs. Apply cold packs to the nose, forehead, and to the back part of the head and neck. Physicians remark. Cold contracts the blood vessels in this region and lessens the flow of blood to these parts. 5. Raising hands. Hold the hands above the head. 6. Alum or salt water. Saturate some lint or cotton in alum or salt water and insert up the nostrils as far as possible or snuff up some powdered alum. Physicians remark. Salt and alum are astringents and help close the blood vessels. 7. Witch hazel. Witch hazel bark inserted in the nostrils will stop bleeding. 8. Powdered borax. Snuff some powdered borax up the nose and at the same time pour cold water over the wrists and back of the neck. 9. Nettle juice. Juice from the common nettle has stopped nosebleed when everything else failed. Wet some lint in the juice and put up the nostril. 10. Ice water or vinegar. Snuff either ice water or vinegar. Apply ice or cold water to the back of the neck or bridge of the nose. Physicians remark. The cold contracts the blood vessels and less blood is carried to these parts. Vinegar also contracts the blood vessels by its astringent or binding action and lessens the flow of blood, allowing it to clot by becoming coagulated or thickened. 11. Closing nostril. Press the nostril shut for several minutes and allow the blood to clot. 12. Fat bacon. Insert in the nostril a narrow strip of salty fat bacon about 3 inches long. Also hold ice in the mouth. Physicians remark. The salt is astringent and aids in closing the blood vessels. The ice contracts the blood vessels in this region. 13. Holding nose. Hold the nose between the thumb and finger until the blood clots, then expel the breath easily through the nose. 14. Paper. Chew some paper to a wad and press it firmly under the upper lip or use the index finger instead. Physicians remark. This presses on the artery in the upper lip and lessens the flow of blood. Nose, things in. If a bean, grain of corn or wheat or any other 4ig body gets into the nostril, take a crochet hook and gently run it back behind the object and slowly and carefully draw it out. A hairpin properly bent may be used if preferred. Sometimes the object may be expelled by blowing the nose. Do everything gently. Seat the patient in a good light, open wide the nostril and put your instrument in or behind the object and draw forward. Do not be alarmed, for if you cannot get it out, any doctor can do so, and in the meantime there is no danger. Poisoning. See chapter on poisons. Sores. Apply camphor and cream either alone or together. White Vaseline is good. For old and foul-smelling sores, apply finely powdered charcoal. Charcoal is a disinfectant. A good wash is made by putting a teaspoonful, 60 grains, of potassium permanganate into a pint of water. Zinc oxide. Ointment is another good application. For freely running sores, use powdered V/white oak bark as a poultice. People's Home Remedies. 1. Hot water. Dip pieces of cotton into very hot water and apply to old sores. This is an effective remedy used in many hospitals. 2. Scraped potato and charcoal. For old ill-conditioned sores, apply equal parts of scraped raw potato and powdered charcoal. This is a very fine application for sores of this kind. Spasms, see convulsions. Sprains or strains, sprained back, etc. Apply cloths wrung out of hot salt water or use wormwood or smartweed tea either with or without arnica. Soap liniment, a soap plaster or soft soap are good applications. Apply Padildock liniment. Canada pitch plaster is another good remedy. Later paint the parts over with balsam of fir and bind with eel skin. Turpentine liniment is excellent, but you must not use it too long, for it is hard on the kidneys. See some of the good liniments given in another part. For a sprained ankle or arm, bathe for a long time with either cold or hot water as it feels best. Between the bathings, dress the parts with lead water and laudanum, using 16 parts of water, 4 parts of undiluted lead water and 1 part of laudanum, then rub b/ethic-thiol ointment or camphor liniment. Mint and laudanum. People's Home Remedies 1. Egg, salt, and honey. Take the white of an egg, a large spoonful of salt and the same amount of honey, beat them together continually for 2 hours, let stand an hour, and then anoint the sprained parts with the oil which comes from the mixture. A man from Montana writes that he had a very badly sprained ankle, but within 24 hours after using this application he walked without the least sign of pain. 2. Clay and vinegar. In case of a sprain or bruise, make a paste of 1 part of blue clay and 2 parts of vinegar and bind on with a wet towel at night. 3. Rosin and butter. Make a paste with some powdered rosin and fresh butter and bind on the parts. 4. Hot water. Pour hot water from a height of 3 feet upon the sprained parts. A man writes that a strained ankle was cured by continuing this treatment for an hour. 5. Alum and egg. Powder a piece of alum the size of a hickory nut, and stir into the white of an egg until it forms a curd. Wet a piece of cloth in this and apply to the sprained parts. Sunstroke, see heat stroke. Smothering, see asphyxia. Stings, see bites and stings. Shock, see apoplexy. Wounds, also see bleeding. Use hot, clean, boiled water to thoroughly cleanse the wound. If any large blood vessels are torn, they must be tied with something until the doctor comes. One can generally stop bleeding by the application of very hot or cold water, or by twisting the blood vessels, or by tying something tight about the limb. Wash the wound clean from dirt and all other foreign matter, then dress it with gauze or linen. An antiseptic like Listerine or glycotymolene should be used if possible to thoroughly cleanse the wound, and some of it should be put upon the dressing. People's Home Remedies 1. White oak bark tea. Cleanse the wound thoroughly with a tea made from white oak bark. 2. Salt water. Bathe the wound with weak salt water made with boiled water. 3. Peach leaves. Peach leaves pounded to a pulp and applied to a bruise or wound from a rusty nail will give immediate relief. Bandaging. 4. Fractures, broken bones, dislocations, etc. Splints. These may be made of pasteboard, shingles, or light boards. They are used to help hold the parts in place and the bandages are wrapped about them. Padding. Cotton batting, soft linen, or anything clean and soft may be used. Some places, like hollows and where there is likely to be pressure, must be padded more than others, but the padding must be done evenly. Bandages. Bandages may be bought or made from old sheets. They should be from 3 to 10 yards long and from 1 to 5 inches wide. For fingers and toes they should be an inch wide. For jaw, 4 inches. For head, 2 inches. For collarbone, leg, or arm, from 2 to 2 inches. Wrap them tightly in a roll and keep for emergencies. Bandages and padding should be perfectly clean. General instructions as to bandaging. After the broken parts have been replaced, the intent of bandaging is to keep the parts in place so as to give nature a chance to form new bone tissue and reunite the bone. For this purpose, splints, padding, and bandages are used. Bind tight enough to keep the bones in place, but not so tight as to shut off the circulation, or you may produce gangrene. Use enough padding to relieve the pressure from the splints. The parts should be padded so as to make them even. The result will not depend entirely upon the setting of the bone. The patient must do nothing either by working or moving that will displace the bone. A great many people are left deformed because fractures have been improperly set. Hospital methods of bandaging. See chapter on bandaging. Urbana-Champaign Urbana. Very few laymen can set them properly. Never set a bone permanently unless it is impossible to get a physician. We will give both temporary and permanent treatment. If, after setting the bone, the part swells much and the patient complains of much pain, especially in a simple fracture, partly take off the bandage until the patient feels easier and then apply again. For instance, if the patient has a broken elbow and wrist, when you loosen the bandage, have one person hold the hand and another the elbow to keep the parts in place. Do not bandage too tightly. You must allow for swelling. A common simple break should not pain much after it has been dressed half an hour. Put the bandage on just tight enough to keep the parts from slipping. Wounds. If the bone comes through the flesh and bone must be thoroughly cleansed and the part must be bandaged so that you can get at it easily afterwards to dress it. You can miss the wound with the bandage and cover with gauze or linen that can be removed. Never put the splint on the wound. If the bone is badly crushed, it must not be put in a splint. Place it in a comfortable position and treat for a time like you would treat a wound. Fractures. A fracture is a breaking of the bone either partly or entirely in two. In children whose bones are soft, we sometimes find the bones bent instead of broken. This is called green stick fracture. Put on pasteboard or light shingle splints, pad well with cotton and bandage. By gradually tightening the bandages you can straighten the bone. Fractures are simple, compound, comminuted and impacted. Simple fracture means that the bone is broken partly or entirely off with no tearing of the flesh. A compound fracture is where the bone is broken and sticks through the flesh. A comminuted fracture is where the bone is broken into pieces or crushed. An impacted fracture is where one end of the bone is driven into the other. This often happens where there is a fracture of the hip or neck of the thigh bone. For practical purposes, these are all the kinds of fractures it is necessary to mention. Fracture of the arm bone, humerus, between the elbow and shoulder. While one holds the shoulder, another holds the elbow and pulls on it to get the bone into place. When in place, the arm will feel even with no deformity and there will be very little pain. With cotton batting, pad the arm from the elbow to the shoulder. Do this evenly and thoroughly, having the cotton about an inch thick. To the back side of the arm apply a strip of thick pasteboard and allow it to extend a little below the elbow. In front apply another piece beginning a little above the elbow, to allow movement, and extending to the shoulder. The two pieces of pasteboard should be wide enough to meet on the sides of the arm. Take a bandage 5 yards long and 2.5 inches wide and begin at the elbow and wrap upward, allowing the bandage to lap from V2 to 1% of an inch each time. When you bring the bandage in front, and again when you bring it behind the arm, twist or turn it inside out so that it will neither slip up nor down. Do this each time you bring the bandage in front and behind the arm. Wrap comfortably tight but not too tight. It should be loose enough so that the patient can move the arm with little pain by taking hold of the forearm with the other hand. While the bandage is being put on, the shoulder, elbow and hand must be held by 2 or 3 parties. After the arm is bandaged, the bandage at both ends may be cut lengthwise far enough to permit tying. Fracture of bones of forearm. As to the use of splints, use the same method as for the bone from the elbow to the shoulder for temporary use. If the bones are broken near the wrist, it is called Coates fracture. This kind of a fracture is very hard to treat, for there is likely to be a dislocation of the outer bone at the wrist. One person should take hold of the elbow while another pulls at the hand until the bones slip into place. Then a third person pads the arm of L with cotton while the two are still pulling. Put on pasteboard or light shingle splints. The lower one should extend from the elbow to beyond the ends of the fingers and should be well padded. The upper one should extend from below the elbow to the back of the hand and should also be well padded. Then, when placed in position and held by other yardies, bandage from the hand to the elbow just tight enough to hold the splints in place. Bandage the same as directed for the fracture of the arm above the elbow. The arm swells rapidly, and if it pains much or the fingers become numb and blue, it is generally because the bandage is too tight. Loosen the bandage a little and this will ease the patient until you can get proper help. Fracture of the collarbone. Clavicle. When the collarbone is broken, there is pain at the injured place or shoulder. The shoulder hangs down and the patient leans to the injured side. For temporary treatment, put a pad under the injured arm and put the hand and arm to the elbow in a sling tied about the neck. If you are where you cannot get a sling, hold the injured arm and shoulder up and back until a sling is obtained, or go to bed and arrange the shoulder and arm in a comfortable position until help can be obtained. For permanent treatment, replace the parts by lifting the shoulder upward, backward, and outward. Do this after you have your bandage and pads ready. The collarbone will look and feel even when in place. Velpo method of bandaging. We will first give the Velpo method of bandaging. Place the palm of the hand of the injured arm on the opposite shoulder with the forearm lying across the chest. Place padding between the chest and arm and hand, and also in the armpit on the injured side. This is to prevent chafing. Use a bandage 10 yards long and 2% inches wide. Place the end of the bandage in the armpit of the sound arm, pass it up across the back over the shoulder and broken collarbone, down the front of the arm on the injured side, then across the arm and under the outside of the elbow, then pass it up across the chest to the place of beginning under the sound arm. Repeat the same way, but when you get to the sound armpit the second time, pass the bandage across the back, but instead of going over the shoulder as before, pass it around the injured arm at the elbow and then across the chest to the sound armpit again. Then go across the back and up over the shoulder and broken collarbone as the first 2 times, and when you get to the sound armpit, go around the body as the third time, lapping from 1/2 to 1 inch, then alternate each time you pass it around the body until you have used all the bandage. Use safety pins where necessary. Dissolve method of bandaging. In using the dissolve method, you use the same kind of bandage. Place the arm in the same position as when bandaging by the Velpo method and pad in the same way. Start from the armpit on the sound side, pass the bandage across the chest and up over the injured collarbone and shoulder and down the back of the arm to the elbow, then pass it across the arm and chest to the point of beginning under the arm on the sound side, then across the back and up over thigh, shoulder and injured collarbone and down the front of the bent arm to the elbow, and from this point across the back to the point of beginning. Repeat these operations, alternating each time, until the bandage is all used. Pin the bandage where necessary and place the hand in a sling. Fracture of the hip. Place the patient in bed and put bags of salt, sand, or bran both on the inner and outer side of the thigh, knee and ankle, and keep there until a doctor arrives. The leg may be short and turn either in or out, and the bags will help keep it in place and ease the pain. If a doctor cannot be obtained, pad the leg well from the hip to the foot and bind on with strings or strips of cloth. Turn the foot out as it naturally belongs, then take a bed slat or strip of board and put on the outer side of the leg. Pad the leg well where it touches the splint. The slat should extend from the waist to 1 or 2 inches below the foot, and there should be a notch cut in the upper end to keep the bandage from slipping off. Wrap pieces of bandage about the limb and slat just above the ankle and the knee and tie there. Also bandage the upper end of the splint well around the body. The splint will now stay in place. Take a bandage 2 or 3 inches wide and begin to bandage at the ankle and proceed as directed in bandaging the arm above the elbow, giving the bandage a twist or turning it inside out occasionally both behind and in front to prevent it slipping. Bandage the entire length of the limb, then put a weight of from 5 to 10 pounds on the lower part of the leg so as to prevent shortening. Fasten a rope to the lower part of the leg by bandaging or by use of adhesive plaster. Let the rope run through a pulley fastened to the foot of the bed and then tie the rope to the weight. Fracture of the thigh bone. Be sure the parts are put in place and then bandage the same as for a fractured hip. You must also use the weight, and even then the limb is likely to shorten from 1/2 inch to 2 inches. The temporary treatment, of course, is to put the patient to bed and place the leg in a comfortable position. If the patient must be moved, place him in a wagon and let him lie down on something soft. Get 2 shingles or boards, Pad the leg well and place one splint on the inner and the other on the outer side of the thigh or whole leg, and then bandage from below upward. This will also do for fracture of either one or both bones of the leg from the knee to the foot. Fracture of the ribs. Apply adhesive plaster from the backbone to the breastbone. Apply the plaster wide enough to extend 2 inches above and 2 inches below the fracture. First measure the length from the backbone to the breastbone. Cut enough pieces of plaster to make the right length and width. Then place one length on the table and apply another over the side of the first one, lapping from to 1 inch, and so continue until you have the band wide enough. It is best to shave off all the hair where the plaster is applied. While the patient stands up with his arms down and gets all the breath out of his lungs, place one end of the bandage on the backbone, then go forward quickly across the chest to the breastbone with the plaster drawn tight and even. Place a strip at each end of the band to prevent it slipping. This band, if properly applied, will ease the pain and should be worn for at least 4 weeks. Fracture of the lower jaw. Use the four-tailed bandage, which is made by taking a piece of muslin 1 yard long and 4 inches wide and cutting it through the middle from both ends to within 5 or 6 inches of the center. After the broken jaw is in position, put the uncut part of the bandage under the chin so as to cover it. Take hold of the 2 upper pieces and tie comfortably tight at the back of the neck. Turn the 2 lower pieces up along the face in front of the ears and tie tightly on the top of the head. Then tie the ends on the nape of the neck and the top of the head together. Keep the bandage on for a week, and for nourishment take milk through a tube or straw. Remain quiet and do not talk. Another way to bandage a fractured jaw is by the use of a bandage 2-0 inches wide and 5 yards long. Start at the base of the skull and go up around the head on the right side to the top of the head, down in front of the left ear, through under the chin, up the right side of the face in front of the ear and over the head to the starting point and fasten with the small safety pin. Then go on around the right side of the neck, under the right ear to the jaw and chin, over the front of the chin and back under the left ear to the starting place, and again use a small safety pin. Make the first round again and then the second, alternating until the bandage is all used. Always pin behind head. When you are through, pin on the top of the head. Fracture of the fingers. Use a rolled bandage of suitable size and close the fingers over it, and then bind them with strips of adhesive plaster running across the fingers, or you can use a rolled bandage to bind about the fingers and hand. Another way is to put a well-padded splint in the palm, allowing it to extend beyond the ends of the fingers. Bind the fingers over the splint just tight enough to hold